Hello everybody, my name is Madeline Mahoney and this is my PowerPoint on low-income youth and sexual safety. So I've identified my vulnerable population to be low-income youth, and just to point out, I wanted to kind of make it a little more clear as to who those low-income youth represent. So there are 72 million children under the age of 18 years old in the United States. However, 43% of those children live in low-income families, and about 21% of those children live in a poor family. These children altogether represent 23% of our population, which comprise 33% of all people living in poverty. So, what defines low income? So, for those of you who don't know, there's this thing called the federal poverty threshold. And the federal poverty threshold expresses a dollar amount approximate to the average minimum income that families need to make ends meet. So in 2015, as you can see here, for a family of 4 with 2 children, they had to be making at least $24,036. However, research should suggest on average families need an income equal to about 2 times the federal poverty threshold standard to meet their basic needs. So I wanted to compare this low-income youth to the rest of our population. So in comparison, the percentage of all children under 18 years old in low-income families surpasses that of adults. And children are twice as likely as adults 65 years and older to live in poor families. And younger children are more likely to live in low-income poor families than older children. And if you can see the chart down here, you can see how it's divided out by age, and if they're less than 18 years old, about 20% of that population is poor, and the other 22% is near poor. Whereas if you go up to ages 18 to 64, only 14% of that population is poor. So I've identified that our low-income youth population is very vulnerable to the STDs and sexually transmitted infections. When I was doing some research, I found a lot of statistics, and just to point out, the U.S. Centers for Disease Control, which is the CDC, stated that people younger than 25 years old account for 2/3 of an estimated 12 million people acquiring an STD each year in the U.S. And the U.S. Census Bureau identified that adolescents suffer from a higher incidence of poverty compared to the overall population. The poverty rate for people under 18 years old is higher than both the rate for people 18 to 64 years old and those 65 years and older. The U.S. Department of Health and Human Services also concluded that at least 25% of sexually active teenagers have become infected with STDs. The American Social Health Association has indicated that 1 in 6 adolescents contract an STD each year. The American Social Health Association also stated that in particular, low-income urban adolescents have the highest rates for some sexually So there's a lot of determinants that, go into the sexually transmitted disease risk and the low-income youth adolescents. And I know we're supposed to pick 3, however, there's definitely more than just 3, but I kind of wanted to show everybody that it's kind of a mix of behavioral, psychological, social, biological, and institutional factors that really determine the risk of contracting a sexually transmitted disease. So I just wanted to point out some facts for you guys in terms of what determines STD risk in adolescents. And just to kind of make it a little more clear, I thought these graphics would be nice to show. So as you can see, Americans ages 15 to 24 make up just 27% of the sexually active population. But of those, they account for 50% of the 20 million new STIs in the U.S. each year. And then over here on the second chart here, you can see that most sexually transmitted infections occur in youth and young adults, and it's split up by chlamydia, gonorrhea, and HPV. And you can see the ages, and most of it falls in the youth, 35 to 40% of it normally, and about each section. So now we're taking a look at some of those determinants, and one of those being behavioral risk factors. And behavioral risk factors can include anything from their sexual behaviors to their drug use to their healthcare benefits, whether they even have access to healthcare benefits. And some of these risk factors can be subdivided down even more. So as for sexual behaviors, the age of first coitus, the current and lifetime number of sexual partners, contact with sexual partners, or even the frequency and type of coitus or the pattern of sexual behavior, and whether they're using a barrier prophylaxis, all goes into those sexual behavior risk factors. And for the other risk factor, drug use, we all know that drugs and alcohol temporarily changes the way we think, and it also can increase sex drive. And with drugs, it's typically associated with exchange of sex for drugs or money, which exposes those individuals to multiple partners with a high prevalence of STDs, because typically, they're injecting drugs and they're sharing needles and they're passing it around. So this is why. So now we take a look at some of the psychological risk factors that go with our risk for low-income youth contracting sexually transmitted infections. So some of these psychological risk factors include, the individual's self-esteem, their personal values, their locus of control and motivation. Because, if we have a student or a child, with poor self-esteem, they may be more inclined to either just give their bodies up, or maybe they'll be more reserved. But as you can see, all those things go into it. And just by having a sexual education class, one that provides good information, we could help provide these teens with guidance and, times to stop and think about the importance of themselves and their bodies. So, anyways, these low-income youth kind of have a sense of invulnerability, and that can encourage a lot of risk-taking. And that's one of the hardest things to control in our adolescence, because we know that's kind of the age to be experimenting and testing new things, but at the same time, we don't want them testing and experimenting with things that they're not ready for or don't have the correct knowledge on. So now we look at our social risk factors, and how that goes into why we need sexual education for our low-income youth. And I just want to point out that, for these social risk factors, a lot of it is these individuals have either, poor role models, they have a lack of economic and educational opportunity, and that can go hand in hand as well with their parents. If their parents didn't have a good educational opportunity, or maybe they only finished high school or not even, then the chances are that they are probably living in more poverty than a parent that may have finished college. Their inaccessibility to adequate healthcare services normally is what contributes to the high STD prevalence among these adolescents, because they feel they're either too embarrassed to go in help they need, maybe somewhere like Planned Parenthood, or they don't have the funds appropriate to make an appointment to see a doctor, or they may even be just too young that they're too scared to say anything about what they may be feeling. And for women, these STDs can be even more harmful, because if it lingers for a long time, it could lead to a serious problem like pelvic inflammatory disease. And with pelvic inflammatory disease, that can lead to a lot of complications for women as well. It could even lead to infertility, and this is why our low-income youth need to have proper education on sexual education, because they don't realize the harm that is going on inside their body when they do contract these sexually transmitted diseases. Just to put some statistics here, highest STD rates occur in younger adolescent females, especially inner city youth and ethnic minority teens. Female adolescents have the highest incidence of gonorrhea and rates for hospitalizations for pelvic inflammatory disease. Black teenagers, in contrast to white counterparts, are more likely to have been infected with STDs. Hispanic teenage females have a higher rate of chlamydia compared to their white counterparts. So you can kind of see how both race and ethnicity also play into the prevalence of STDs among who contracts them. So when we look at our biological risk factors, we're starting to look at the body more. So in our generation, especially this century, the average age of menarche has decreased, which means that adolescents can begin sexual activity earlier than they would have been in previous centuries. And this increases the number of years of possible exposure to STDs, right? Because the younger that you can start having sex, the more possible it is that you're contracting a sexually transmitted disease. Also, what many of the individuals don't know, especially females, is that the columnar epithelium in the uterine cervix of the young adolescents may not provide as much protection from STDs as the tissues of a mature woman, which again is another good point of why we need to have good sexual education, because these are points that individuals don't know about. So looking at our institutional risk factors, this is pretty much our school systems. And traditionally, it has been founded that schools focus too much on the biological aspects of STDs and give inadequate attention to the behavioral messages and health promotions and skill development that need to go along with proper sex education. So it's kind of like this very misfocused curricula. And if you didn't know, highly effective sex education programs, preventative programs, aren't even eligible for federal funding. However, abstinence-only curriculas are federally funded, even though an analysis found that over 80% of the curricula supported by the U.S. Department of Health and Human Services contain false, misleading, or distorted information about reproductive health. So how is that helping our low-income youth and our youth just in general? So in terms of improving health literacy, I believe implementing a peer group program on sexual education could be very beneficial. I believe this would work because since adolescents are becoming more independent in that developmental stage from their families, their relationships with their peers are becoming increasingly important. And I believe that method would work because the associations that they do make influence adolescent development and provide a good source of information to make decisions. They may be more inclined to listen to the information between peers rather than listening to some 45-year-old man with a monotone voice educating them on sexual education. Another method I believe that would work to increasing health literacy would be to use social media. Since our youth today was born between 1994 and 2003, they're considered millennials. And as everybody knows, this generation is extremely connected with technology. And in case you didn't know, 93% of youth ages 12 to 17 are online. So that already goes to show that using, the internet can be a huge source to get information out to this age level. So, using the internet has the potential to reach possibly the greatest number of adolescents to educate a diverse range of sexual health topics. Many low-income families, they typically choose to seek information online before seeking more traditional healthcare options because they typically don't have that money to spend on a doctor's appointment and will try to find ways online or herbal home remedies maybe to help with their problem. One other way to improve health literacy is to provide quality learning materials that provide information on sexual education at an age-appropriate level, such as early elementary level, middle school level, and high school levels. Providing these learning materials that are appropriate for their age and developmental stage will further help the individuals understand the material in a simple language that they can understand. And then also included in this method, it would be good to use the teach back method to determine if the individual has understood the instructions and can repeat them back in their own words. That's the best way to test their knowledge. So I think all of these methods would be great ways to improve health literacy. So thank you everybody, and this was my PowerPoint on low-income youth and sexual education.